If you run a healthcare agency, stop what you're doing. This is the most important few minutes you'll spend this week. I'm going to show you the one broken thing that is quietly burning out your best clinicians, slowing your billing to a crawl, and getting your claims denied. And I'll show you how agencies are fixing it with a new HIPAA-compliant AI. Without hiring a single person, and without switching the EHR you already use. This is for you, whether you run home health, outpatient, skilled nursing, or contract therapy. And watch till the end, because there's a special offer for agencies that act fast. Picture a day you already know too well. One of your best clinicians is at her kitchen table at 10 at night, still charting, hours after her last visit. Your billing is stuck, waiting on notes that aren't finished, so money you already earned just sits there. And on your desk is another denial. A visit that happened, care that was given, and they won't pay for it. It feels like you're fighting three separate fires. A staffing problem because your people are burning out. A billing problem because the cash isn't coming in fast enough. And an insurance problem because the denials keep coming. So you fight all three at once, and it never quite works. Here's what I want you to see. Because once you see it, you can't unsee it. These are not three problems. They are one problem wearing three masks, and it all traces back to the same place. Documentation. Notes done by hand, from memory, in a system that forgets the patient the second you hit save. Knock that one thing down, and all three fall with it. In a minute, I'll show you the exact words a real insurance company used to deny a real claim. But first, understand what's really happening to your team. Your clinicians are working a second shift every single night. An unpaid one. And that second shift is the real reason your best people burn out and quit, not the patients. The paperwork waiting for them at home. And here's the hard truth. You cannot hire your way out of this. Because every new clinician hits the exact same wall. And every time one walks out the door, it costs you. Replacing a single clinician can run you $30,000 to $50,000 once you count recruiting, onboarding, and ramp up. Now multiply that by how many you've lost in the last 2 years. But burnout is only the first mask. Here's the second. While your clinicians are behind on notes, your money is trapped inside them. Because notes are the trigger for billing. An unfinished note is unbilled work. And the most dreaded note of all, the start of care note, is so long that even great clinicians put it off. And in home health, that delay has a literal price tag. File the notice of admission late, and Medicare cuts 1/30 of the payment for every day you're behind. A week late can erase nearly a quarter of what you earned on that patient. Not because the care was late, because the note was. Now, remember those words I promised you? Here they are. This is the actual reason a real Medicare Advantage claim was denied. The records do not clearly show the progress towards your therapy goals. Read it again. They did not say the care was bad. They said the records didn't show it. The work was done. The patient was helped. And they didn't get paid because of how it was written down. They denied the records, not the care. This is the difference between getting paid and getting denied. On the left is how most notes get written. It logs what happened, but a reviewer can't see why skilled care was needed or any progress. On the right is the exact same visit, with the numbers and the clinical reasoning, measurable progress, and why a skilled therapist was required. Same patient, same visit. One gets denied, the other gets paid. And here's what most owners miss. It isn't just the evaluations. It's the rushed daily notes, fired off at the end of a long day, that are too thin to prove anything. That's where progress not shown denials come from. And those are the most rushed notes of all. And it's about to get harder. As of January 2026, Medicare itself launched a new program that uses artificial intelligence to review whether your services get paid. This is not coming someday. It is here, right now, in a growing list of states. So think about what that means. On one side, insurance companies and auditors using AI to scan your notes for any weakness. On the other, an exhausted clinician at 10 at night, writing from memory. That is not a fair fight. You cannot send your people into an AI review with a pen. I know that fight intimately because I lived it. Let me tell you how. My name is Terry Keys. I'm a physical therapist assistant. I spent over 5 years in home health, seeing patients in their living rooms every day. I loved that part of the job. What I hated was what came after. Every night I'd come home and spend my whole evening typing up notes. Time that should have been with my family. Gone. And I finally realized something. It was never the patients that burned me out. It was the documentation. The care was the joy. The paperwork was the weight. So I went looking for a way out. I tried ChatGPT, but I still had to copy and paste every section back into my EHR by hand. Other tools were too expensive, or only sold to big companies, or locked to one specific EHR. Nothing worked for the person actually doing the documentation, so I built it myself. This is Soap Note Buddy, the HIPAA-compliant AI that gives your clinicians their nights back, gets your notes done on time, and makes everyone stand up to a denial or an audit. And it works right inside the EHR you already use. Here's how it works. In 3 steps. 1. Your clinician just talks naturally. The voice scribe listens. 2. It builds the patient's story over time, remembering the evaluation and every prior visit. 3. With one click, it fills every field in your EHR in skilled, defensible language. Watch this. Here's a real note, start to finish. The clinician records the visit. The AI pulls in everything it knows about this patient, and with one click, every field fills. What took hours now takes a minute or 2. It knows this patient across visits and writes in the exact skilled language a reviewer is looking for. And because it fixes the one root cause, it solves all 3 problems at once. The after-hours charting is gone, so your best people stop burning out. The notes are done on time, so your cash stops getting trapped. And every note is provable, so it survives the denials and the audits. But here's what surprises most agencies. You can actually get this set up today for your whole team, and for a lot less than you'd think. It's simple. We have 2 agency plans, base and voice. I'll show you each one. First, the base plan includes unlimited patients and notes so you never hit a cap or pay overage fees, no matter how busy your caseload gets. One-click EHR autofill, so notes are done in seconds instead of typed by hand, saving hours every week. EHR fill rules, so clinicians tell the AI exactly how to fill their EHR to improve the quality of their notes. AI note generation, that turns a few words into a complete, defensible note. An AI chat assistant that answers clinical and documentation questions on the spot. Custom note templates, so every note matches your agency's exact format. And PDF and document uploads, so you pull straight from faxes and eval docs with no retyping. Base seats are best for PTAs, OTAs, or any assistant who delivers hands-on care and doesn't need to capture much by voice. Add it up, and that's over $300 in value every month. But you won't pay that. A base seat is just $59 a month, a fraction of what it's worth. Voice seats include everything in the base plan, plus a HIPAA-compliant voice scribe, so clinicians stay fully present with their patients without missing important spoken details. Medically trained transcription that creates extremely accurate notes and replaces a medical transcriptionist, costing around $2,500 a month. A patient checklist, so clinicians never miss a talking point, and their documentation comes out highly detailed. And smart image analysis, that captures med lists, wound photos, MRIs, X-rays, or any image, saving even more time. Voice seats are best for PTs, OTs, nurses, doctors, or any evaluating clinician who needs to capture detailed patient information by talking. Altogether, that's over $3,000 in value every month per clinician. But you won't pay that either. A voice seat is just $89 a month, a fraction of what one transcriptionist alone would cost you. Mix and match however your team needs. And right now, you can start the whole thing for free. Think about what that's actually worth. It gives each clinician about 8 hours back every week. That's 1 to 2 more billable visits a day, or simply going home on time. Across your whole team, that's tens of thousands of dollars in recovered revenue every year. And it keeps your people because the after-hours charting that burns them out is gone. Replacing a single clinician costs you $30,000 to $50,000. This is a fraction of that. Now let's talk about what it costs to do nothing. Because doing nothing isn't free. Every quarter you wait, you keep paying for it. In lost clinicians, in trapped cash, in denied claims, in growing audit risk. That's the real bill. And you're already paying it. So picture a few weeks from now instead. Your clinicians are finishing their notes before they leave the last visit and actually going home on time. Your billing team isn't chasing anyone. The notes are just done. The denials slow to a trickle because every note proves the skilled care your team already gave, and you're not the one staying up worrying about it. That's not a fantasy. That's just what happens when you fix the one broken thing. So here's what I want you to do. Start a free 14-day trial of the agency plan. No contract. Cancel anytime. Roll it out to your team and watch what happens to your notes this week. Because the question isn't whether this works. You've seen exactly how and exactly why. The only question is whether you keep paying the cost of the broken system or test the fix this week for free. And let me answer the 3 things you're probably thinking. Will it work with our EHR? Almost certainly. It reads the page like a human. No integration, no IT project. Is it really safe? Yes. It's fully HIPAA compliant, with PHI removed before AI processing, under assigned BAA. And will my clinicians actually use it? They're being asked to do less, not more, so adoption isn't the fight it usually is. Now, here's a fast action bonus. If you start within the next 3 days, I'll set you up as a founding agency. First, I'll lock in your pricing for life. Whatever you pay today is yours forever, no matter how much we raise prices for everyone else. Second, I'll extend your trial from 14 days to a full 30, so you get an entire billing cycle to prove the return. And third, for every 10 clinician seats you add, I'll give you one of them free, for life. Add 10, 1 is free. Add 30, 3 are free. Those seats stay free for as long as you're with us. And here's my guarantee. Try it with your team for a full 30 days. If your clinicians aren't documenting faster and getting their nights back, cancel and you owe nothing. It's fully HIPAA compliant, PHI is removed before AI processing, and everything runs on HIPAA compliant AI under assigned BAA. No contract. Cancel anytime. The only thing you're risking is another quarter of the way things are now. So start today. Click the button below this video. It'll take you to our agency plan page, where you pick how many seats your agency needs. And if you start in the next 3 days, you lock in the founding offer before your window closes. And the next time a denial shows up, your notes will be ready for it. And if you're not sure it fits your situation, your EHR, your size, your workflow, don't just close this video. Book a quick 15-minute call or send us your question, and we'll give you a straight answer. Remember the one thing. Burnout, slow pay, and denials are not 3 problems. They're 1. And now, you have the one fix. Go give your clinicians their nights back and give your agency its margin back. Start today.